Thank you, everyone, for joining me. My name is Zig Bell. I'm the co-founder and CEO of A Design Plus Consulting. Fast Plan is an application that creates scenarios for healthcare facilities to be more easily planned, designed, and operated. Here's our pitch. I've been designing and overseeing the construction of healthcare facilities for over 30 years. And the one thing that I've learned that's common in all of these projects is that we've remodeled the projects before they're open due to functional changes and needs. And one of the things that we learned in this process is that these changes are costly and there are multiples on the dollar to make the changes at the time of opening. And I did not, nor did the owner, have a tool to address some of these functional changes prevented from happening. To highlight the problem, I wanted to show, which I think you all know, that we develop our design in silos, and what we're trying to do is to connect what the customer wants and what their business operation is to the end. And because many of us pass a lot of hands during the process, the main message is lost. So in a systems integrated approach, you are able to connect the customer needs and business model to the commissioning and the operations. The real challenge that we find, and I've experienced, is that the tool that is commonly used to check the needs is Excel. And with Excel, you can't really look at causation as to why certain outcomes are existing. So for the last 10 years, my team and I have been prototyping this approach on around 14 million square feet of projects throughout the world. And I'm going to show you some examples of the outcomes. So the first project is in Saudi Arabia, where this was for a brand new city. So there was no data. So we used publicly available data to show the client for their new medical center in the city that a outpatient approach would use 1/3 of the inpatient beds initially thought, and it would save them about slightly more than half the cost that they had budgeted. And this is an example of a care plan, which is one of our pillars and foundational elements of our software, which is a virtual representation of how a patient experiences care. The next project is where, in healthcare and probably many other projects commonly exist, where the project sponsor and the user could not agree on sizing requirements. So we engaged the client to get agreement on how big the hospital needed to be. And through our modeling effort, we were able to show them that they didn't need as many beds nor radiotherapy rooms, which are around about $10 million a piece. And the reduced hospital size allowed for a larger research building, which is what the client really engaged us for. And in this particular project, we used both publicly available data and the client data. In this particular project in Uttar Pradesh, India, the client wanted to improve the patient care. And this is a setting where approximately 400 to 500 patients come to see an individual doctor per day. So the demand is quite high. So our approach was to institute a filter clinic, and the filter clinic gleaned between 30 and 60% of the patients from the senior consultants. And this allowed the clinics to not only see more patients, and it also allowed significantly more time for the patients to be with the doctor. So it provided much better care. And on this particular project, we used publicly available data as well as our team gathering data themselves. On this particular project, the client needed to make the difficult decision of closing a hospital. And the question was, could two hospital emergency rooms be operated in one. So we got 1 year of electronic health records along with publicly available data. And we crunched a lot of numbers and were able to show that with some mostly care plan changes and primarily using a team triage approach, that you can in fact fit 2 hospitals worth of ER patients into 1 hospital. And this project is in the process of getting built. This particular project in New Delhi, India, is our largest model. The client was looking to build a 1,000-bed expansion and wanted to make sure that their investment dollars were being properly spent. So we built a model that had almost 2,000 beds. And one of the key requests from the client was to what we call restack the hospitals so that each hospital didn't have the same department in it. We were able to identify what they called centers of excellence in the new program. And this gave them the confidence that the 2,000 beds that they were looking to build both made financial and functional and clinical sense. And the last project is an emergency room project in Detroit, Michigan. The diagram that you're seeing shows how the patients flow in the ER during the day, starting from midnight all the way till 11 o'clock at night. And the client wanted to make sure that their investment was going to stand the test of time. So what you see are the arrows up top, and the green, yellow, and red are the different percentages of increase of demand. So as the demand increases, you could see how the capacity, which is around 50 beds, when it may be more than needed. And this gave the client the confidence that the investment that they were going to make in this facility would stand the test of time and be able to grow with an increased demand of 25%, which is unlikely, but could be possible. So what FastPlan does is not only provide downloadable results, variety of data types, epidemiological data, but it allows the client to run hundreds or thousands of scenarios. And the real value for the client is it provides stakeholder consensus as well as allows them to find innovative solutions that they may have not looked at previously. So you might be wondering who our competition is. Our competition is typically consulting firms that sell hours and project past performance metrics on the future, which is not a good way to determine how facilities are going to perform. The other competitor in this space are healthcare data companies using analytics, and they primarily look for patterns in data. What our real differentiation is using epidemiology tied to spaces, understanding patient outcomes. Our engagement model is a SaaS platform. We see that there are 2 modes, basic and or advanced, looking at the different sizing requirements, key drivers, space program, Revit libraries, staffing, operational care plans, financial performance, and surge analysis given the COVID-19 situation we're in. Our customers is the entire healthcare ecosystem, starting with the operators and their team, along with all of their vendors, the designers, builders, strategy consultants, and developers. And we are targeting that there are different user types within each. Our team, there's myself and a co-founder, Dr. Vamshi Gankiti, and we have several other team members throughout the world. We're based in San Francisco, and we have offices in Bangalore, India, and Shanghai, China. Just to wrap things up, we've created a scenario-based epidemiological evidence-based best practices tool, which I know is a mouthful, for healthcare facilities from our services-based business. It's currently at an MVP stage, and we are looking at doing lead testing scheduled for next quarter. And we're basically looking for acceleration in our tool. It could take the form of a strategic relationship with a customer and or a seed investment. And I want to end that I know that there have been some really amazing companies pitching both today and yesterday. And what I think we're differently focused on is that we want to ensure we're building the right building, which ensures sustainability and resiliency in our world. And the way we can not build too many buildings is functionally understanding what the buildings are. And that's what FastPlan is. Okay, thanks, Kayla.